Good morning.
Good morning, Doctor.
My name's Dr. Farrant.
Hello.
Can I just check your name, please?
Yes, Mrs. Rigby.
Nice to meet you, Mrs. Rigby. So I understand you've come to hospital with back pain, is that right?
That's right, yeah. I've had it on and off for about probably 4 months. Obviously, it's just got worse and sort of ended up here.
Okay. And so when you say it's been getting worse, what was the sort of trigger that made you actually come to hospital?
Well, I had a fall. I just fell down a couple of stairs. And it just, from then, it just seemed to knock something out. I feel like it knocked something out of place, you know.
Okay.
I've had a bit of an ache, but I do look after my grandchildren, so I'm always picking them up. So I'll sort of put that down to general aches and pains. But this little knock, I don't know whether I somehow knocked something. Not quite sure.
And does the pain in the back go anywhere else? Does it go into your legs, for instance, or into your belly?
Not really, no.
Okay. And what about any sort of changes in sensation at all? Have you got any numbness in your legs or problems when you go into the toilet or anything like that?
No, no.
Okay. And I know you've had some x-rays done on your back, is that right?
Well, I had an x-ray yesterday, and the doctor said he thinks it's osteoporosis, so that kind of explains things. You know, obviously you get these type of things, don't you, as you get older, and not so much calcium and everything. That's how I understand it. So so they did an x-ray. They did another scan, but I think that was just to confirm that there was a fracture.
Right.
I think that was just for that, as far as I know.
So that other scan was actually a bone scan. Okay. And that's a scan to look to see if there's any other potential causes for what could have caused the fracture.
Yeah.
Right. And that scan's actually not normal.
Right.
Do you want me to go into that scan in a little bit more detail?
Do you mean that I have got osteoporosis?
So actually the scan has shown that it's not osteoporosis that's caused the problem. Okay. Actually what it's shown is that unfortunately this is cancer.
But he said it was like a fracture yesterday. Can't be cancer, surely. I had cancer 6 years ago, but that was all sorted out, so I had a mastectomy. So, do you mean this is related?
Potentially it could be related, yes. And we're going to need to do some more investigation to actually work out whether this is or sort of a recurrence of the breast cancer that you've had, or whether this is a different sort of cancer. You're going to need some more tests now to work this all out. Okay. And you do have a broken bone in the back.
Right.
All right. So I don't want to get away from the fact that that this is also a broken bone that might need some treatment.
Yeah.
And what's happened is the cancer that's gone into the spine has made that bone unstable. All right. And so the minor fall that you had was enough to break that brittle bone, because it's not just solid bone now, it's got cancer in it. Does that make sense?
To be honest, it's a bit too much to take in.
I'm sorry to give you such difficult news.
I just wasn't expecting it, that's all.
I know it's come as a shock. But also it's important that now that we've got the diagnosis and we know that this is the problem, we now think about where we're going to go next and what we're going to do to treat this. Yeah. All right.
Okay.
So, would you be all right if I now just did a bit of explaining to you about where we're going to go next and what the next steps of treatment are? Because I don't want to just give you the diagnosis and then it's important that you
Yeah.
realise that this is something that's potentially treatable. Okay.
Yeah. Okay.
So what we need to do now is, first of all, make sure that the break in the back is safe. Okay, and if you need any treatment to the spine to make sure that the spine is stable, give you that treatment. Also, we need to work out what kind of cancer this is. So you're going to need an examination of the breasts and some scans of the breast to make sure there's no recurrence of the breast cancer. And also we'll need to do a CT scan of the body to look to see if there's any other evidence of cancer anywhere else.
Okay.
It may also be that we need to take a biopsy on a sample of the cancer that's in the bone to look at it under a microscope and see if there's any other abnormalities in it that could help guide us with treatment going forward.
Yeah.
All right. Then we need to be thinking about how we're going to treat the cancer. And that very much is going to depend on what the primary source of the cancer is, whether this is coming from the breast or whether it's coming from somewhere else.
So do you mean the other breast? Because I had a mastectomy.
Yes. So just because you've had a mastectomy doesn't mean you can't get a recurrence in the other side.
Yeah, yeah.
All right. So that's one option, and that's where we're going to be going next. Okay. I don't want to go into great detail with you today because it's important, because it's a lot. It's a lot to take in today.
It is a lot to take in. Yeah. It's the last thing I was expecting to hear.
I know. Equally, I'm not just going to give you this information and go away. We've got a whole support network here to look after you now and help you through this. So, when you had your breast cancer, you probably had some time with the Macmillan team, the Macmillan nurses, and so definitely what I'd like to do now is get the Macmillan team to come and talk to you about the support that they can give you, because you're not alone with this. You're not going to be on your own coping with this.
Yeah, they were very good last time.
Yeah, so we'll get them to come and have a chat to you as well.
Okay, thank you, Doctor.
All right. Have you got any other questions you want to ask me at the moment?
To be honest, I can't really think straight. To be honest, I thought it was a fracture. It's a fractured back.
Well, it is a fracture in the back.
Not the other thing.
But sort of not the simple osteoporosis type fracture that we were expecting.
Yeah.
And unfortunately, this is something that we do see, and that's what we've got, and that's what we're dealing with. So it's important that now we think about how we're going to move on.
But it is treatable, bone cancer.
Potentially, but until we know what we're actually dealing with, until we've done these further tests, it's difficult for me to say at this point. Okay.
I was at the doctor's 4 months ago. I've been back a few times, and he never suggested that it could be anything like this. I mean, I could have been having treatment 4 months ago, couldn't I? I mean, it might have got worse because he didn't prescribe me. He didn't, suggest what it could be.
Well, I mean, I wasn't there 4 months ago, so it's difficult for me to comment. But what I do know is that it's very, very common for people to go and see the GP with back problems. And in the vast majority of cases, it's pain that's coming from the muscles. And it's normal for us as doctors to treat the things that are common. And if that treatment doesn't work, then we look at other options. So I think it's important to say, I think the GP did the right thing in initially thinking that this was muscle problems. And then now that we've realised it's not, we now need to think about where we go next. Is that all right?
I'm just a bit worried about how things are going to go now.
Well, I can see that that's something that's worrying you. Okay. But, the important thing to focus on is that there's potentially treatment options here. And we now need to do, like I said, the tests to work out exactly what sort of cancer it is. and then make a decision about treatment going forward.
Okay.
Thank you.